Hello, I'm Dr. Qureshi, and here we are with Q&A with Dr. Q. Why my dog is dragging his rear end to the ground, or scooting on the ground, or dragging their butt on the floor. There are many terms people use when they come to me in a vet practice. They use different terms. So the main reason for that is because dogs get anal sac infection or irritation. So the skin is irritated, they're dragging their rear end to the ground because it's itchy, and itchy because their glands swell up. What are anal sacs, or what are the anal sac glands? Behind the rectum at 4 o'clock position and the 8 o'clock position, there are two glands they call anal sacs. They are scent glands. Periodically, they fill up with secretion, or they don't drain properly. Especially happens in small breed dogs, but happen in large breed dogs as well. So dogs the only way for them is to either turn around and chew that area or drag their rear end. So that can be concerning. So you should consult your veterinarian, and what they will do is they will examine your pet, they will shave the back end, the rectal area, apply some ointment on it. They will put gloves on, insert their finger in the rectum, and they squeeze or express the glands so the condition is relieved. But do consult your veterinarian on it. It can be serious. Sometimes, occasionally, there can be an abscess there. There can be a tumor of those glands there. So you should not take this lightly. It can be serious. So you seek that care the first time, and if that problem is still not resolved, sometime your veterinarian will recommend having the pet sedated and having those glands flushed under sedation or the anesthetic, because there could be some material in those glands there which are not flushed out by just a manual squeeze and all that. And sometimes people get frustrated and say, I just saw my veterinarian about a month ago, now the problem came back, maybe didn't do the good job, and a lot of conflict happened between the pet owner and the practice. And it's frustrating for the team at the vet clinic. I think it's all a matter of education. You should understand that yes, they have done a good job draining it, but sometimes if the material or the infection is deeper into the gland, vet may have to use oral antibiotics or even flushing the gland under the anesthetic or sedation so they can treat that properly. In extreme circumstances, if a problem is very chronic, then sometimes those glands can be removed. They serve no purpose there. So, and occasionally, very small percentage of the pets, those glands can be also removed surgically. And I have seen only a few times in my practice for over 30 years, 9 out of 10 times you can have them drained manually, or under sedation you can have them treated medically, flush them out with antiseptic and antibiotics and all that, and that can cure that problem. But it can be serious. You should see your veterinarian if you notice the dog is scooting or dragging their butt on the floor, so they can diagnose what the real reason for it.